Great to see you all here. Really good that there's so much interest in responding to the government's guidance. I know how busy everyone is, so yeah, we really appreciate your time joining us today. We are recording. We're going to record the first half of this session with the people who are, with Hannah particularly, who's going to describe how to respond to this government consultation. So if you want to switch your cameras off for this first bit, please feel free to do that, and then we'll stop recording when it comes to the discussions, and you can switch your cameras back on if you'd like to. You don't have to switch your camera off, of course. It's entirely up to you. My name is Victoria. I work with the Culture, Health and Wellbeing Alliance. I'm a white middle-aged woman. I'm sitting in a sort of cream room. I've got short hair and I'm wearing glasses. This event is a partnership between the Culture, Health and Wellbeing Alliance, the Lived Experience Network, or the Lens, and the National Centre for Creative Health. We've got people from all of those organisations here with us, and we'll together be helping to run the breakouts a bit later on. As you know, the reason we're here is to talk about the government's call for evidence on what they can do to improve everybody's health and well-being. So we've been advised that the more responses that are submitted to this call, the better. So we're here for two reasons. One is to get your thoughts on what we should say in our responses, and the other one is to help you make your own responses to the call. And Hannah from the National Centre for Creative Health is going to talk you through how to do that shortly. And after she's given you a bit of a guide on how to respond, we will set up some breakout groups so that we can all discuss the key themes in the consultation and where your work and your ideas might fit best with that. As I said, in the breakouts, one of us from the three partner organisations will support that conversation and feedback at the end. So we're going to reiterate this a few times probably, but it's important to say that you don't have to respond to every part of the consultation. I know everyone has limited time, so don't let that put you off. It's quite possible to respond to one or two aspects and for that still to be really useful. We'd really like this session to be a bit of a chance to have an informal, open discussion about it and a bit of a sharing amongst ourselves to help us think this through. So Hannah is going to talk you through the process now. If technical questions come up about the process while she's talking, we would love it if you would put those in the chat, and we'll either pick up on those straight after she's finished or at the end of the meeting. When it comes to content, it might be best to save that conversation for when we're in the breakouts. But as I say, if you've got burning technical questions, please do put those in the chat. And Hannah has kindly said that she will be available to discuss this with people after this conversation as well. So, right, I'm going to hand over to Hannah now.
Okay. Thank you very much, Victoria. Hi, everybody. So I am Hannah. I'm a white woman with short reddish hair, working from home today, so I'm sat in my dining room surrounded by a couple of plants. And I am the Research and Policy Manager at the National Centre for Creative Health, and I'm really pleased that you've been able to join us this lunchtime to talk about the government's consultation on its new plan around mental health and wellbeing. So just bear with me a second while I share my screen. Can you see that slide now? Good. Okay, thanks, Victoria. Just to run through again what we're going to do today, we want to introduce the consultation and start to think about what we might want the government to know about the role of creative health in mental health. And then, as Victoria said, to encourage people to submit their own opinions and evidence. So as NCCH, CHWA and Lens, we will be responding, but we know that a number of voices talking about the value of creative health can have a big impact. And we also know that there's such a breadth of work using creative approaches for mental health. We want to make sure that that experience and expertise is represented. So for today's session, I'm going to briefly introduce the discussion paper, what it is and what it's asking, and then we'll take a bit of time to look at where you can actually find the documents and how to make the submission, and then we'll split out into the breakout rooms and it will become a bit more interactive. So what is the plan and how does it relate to creative health? Firstly, I should mention that health and therefore mental health is a devolved issue. So this plan relates to England, but also evidence that works, that looks at what works well elsewhere would be relevant for the consultation. The discussion paper sets out government's intent to establish a long-term 10-year mental health strategy. It recognises that there's an increase in people living with mental health conditions and the impact that this is having on individuals and on health services, and also that this has been exacerbated by COVID-19. And it asks us to think about what we want mental health services to look like in 10 years' time. It also links up with other government policies, such as focus on levelling up and health disparities. So in it, there's quite a lot of emphasis on ensuring equal access to services and looking at the wider determinants of health that might mean that some people are more at risk of poor mental health. It also aligns with the NHS mental health long-term plan, which sets out how the NHS mental health services are run and prioritised. So that's also due to be updated, but it widens that out to consider how other sectors can contribute as well. We've got quite a lot of evidence for the value of creative health approaches in mental health. We've summarised that very briefly in the document that was available with this session, but we also know that there's a lot going on and we want to make sure that people know about that. Some of the issues that have come up in this consultation, they chime quite a lot with the work that we've been doing with NCCH, for example, around integrated care systems as they're forming and thinking about how creative health can be fully incorporated into healthcare systems, how cultural, community, voluntary sectors and different providers can work together towards that. And also around personalised care and routes into creative health through social prescribing, for example, which is well supported at the moment. And our aim is to ensure that the benefits of creative health are recognised and that the right conditions can be fostered to allow that work to thrive and for everyone to be able to access creative health. So we think that this consultation is a good way to make policymakers aware of our work and also what we think is necessary for further support. So just thinking about who should respond to this consultation. Some work's already been done with a range of stakeholders, including people with lived experience, to set out some of the key themes in this discussion paper. And the idea now is to open that consultation up more widely to anyone that's got an interest in mental health, to think about and identify what the priority areas are and to inform the specifics and the vision for that plan. So this is, it's still quite an early stage in the process, and the consultation is going to be followed up with further engagement opportunities, which we're going to be keeping an eye on as well. And this is the list from the government of who they want to respond, and you can see that that's pretty broad. And I think just to mention here as well that even though it's called a call for evidence, evidence doesn't here necessarily mean academic papers or evaluations with data and statistics. They are actually asking for views and opinions of everyone that's got an interest in mental health. And that could be personal or professional. So we'll have a closer look at the questions a bit later on, but you'll see that they can be answered from an individual or organisational perspective. So for example, you might want to talk about how you felt personally when trying to access mental health services, or you could discuss the barriers you've experienced as a practitioner, maybe trying to work across sectors, and either of those things would be welcomed. The consultation takes a very broad scope and it covers all aspects of mental health. So it looks from everyday well-being to severe mental illnesses. It thinks about individual and population health. It talks about prevention, treatment, and improving quality of life for people living with a mental health condition. And it asks about all different stages and age groups. So as I think Victoria mentioned before, we just want to emphasize that a response doesn't have to answer all of those questions or consider all of those aspects. If there's just one thing that you want to say, that you can still put that into your response. And during the rest of the session, we'll start to think about how your different experiences might fit into these different sections. But just to highlight, it's fine to just focus on one aspect. And then also to bear in mind that as you work through the consultation document, some of the questions are structured around the life course. So it does ask you to specifically think about different age groups and different sections that might take action. And then at the end, there's this opportunity to talk about more broadly what you think the underlying values and principles should be. It might not necessarily fit your experience, or it might not be the way that you choose to approach it, but it is the way that the form is structured. So you just need to think slightly about where some of your responses might come. And that might become a bit clearer if we look at some of the actual documents and forms. So I've just prepared this as a short video just to save faffing about with screen sharing during the live session. And this just talks a bit through where the documents can be found and how to actually make the submission. So just pop onto that. Do give me a yell if you can't hear this when it starts. And then after this, we'll go out into the breakout rooms and the session will become a bit more interactive.
So here I'm just going to do a brief run through of what the consultation actually looks like when you come to submit online. Some people have mentioned that they haven't responded to a government consultation before, and this one is quite long, and there are a few different documents and different ways that you might want to respond. So we'll just briefly run through how that works practically. The first thing you can do, we've provided a link in the chat that will take you to this summary page about the consultation. So you can see here as a brief description, runs through some of the things that we've just talked about in the session. And then you have links to the various documents that are associated with the consultation. It also gives you a link to the online survey to respond, and worth pointing out that you can also respond by post if you prefer. But we're just going to run through how to do the online submission here. So from this document, you can get through to the full discussion paper. And we've also put a link to this in the document that we provided. It's quite a long document. It provides the government's stance and its ambitions. It reviews the evidence in quite a lot of detail for each of those 6 key areas, and provides a lot of references and data that you can refer to. So if you're interested in this topic, it is quite an informative read, and I'd recommend, if you have the time, having a look through it before you put together your response. However, when it actually comes to filling in the response, a more useful document to refer to might be this quick read version of the consultation. So we'll provide the link to this as well. But again, so it just runs through a summary of the consultation, and then a very brief overview of what's included in each of the sections. And then the useful thing here is that they've listed all of the questions that are asked throughout the consultation in one place. So this is the same format that the questions will show up in the online portal, and that you'll be able to fill in with your own text. So this is quite useful to have a look at in advance. And I think what I'm going to do with our response is prepare my answers to each of these questions in advance, and put that into a Word document. And then I can copy and paste that over to the online document, the online portal for submission when we're ready. So if I show you the online portal, it might be clearer what I mean by that. So we've provided a link to this as well, and then you can also get to the online survey through the link in these documents. So this is what the online survey portal looks like. Just worth pointing out here that it does ask for you to not include any information that might identify you or somebody else in your responses. It does ask for an email address at the beginning, but that's not related to the answers that you provide. So there won't be any individual communication about your response. If I click on next, it does ask for some initial information about the capacity in which you're responding. So I'm going to say that I'm an individual sharing my professional views. Some of these initial demographic questions do change depending on what capacity you're filling it in, but it doesn't affect the actual consultation questions. And also to say that it does, if you use the same browser, it saves your responses as you go along. So you might not make it to the submit button in one go, but if you reopen in the same browser, it should have saved some of your responses. And that's why some of these are showing up here, because I've been through this previously. And just to mention that it is also possible to fill this in on somebody else's behalf, and you can answer to say that you're doing that as well. So just flip through these demographics. This is the part where it asks about your email address. I've just put no, so my email address is not on the recording. And then finally, you get through to the actual consultation questions. So you'll see that this relates to section 1. This is about promoting positive well-being, and just want to reiterate that you don't have to answer all of the questions in the consultation, but as far as I can tell, what you do need to do is work through all of the questions and leave the answers blank if you don't want to respond. So for example, in this first question about helping people to improve their own well-being, let's say I have something that I want to say about infants and older adults, but I don't have anything that I can add about children and young people or working age adults. So I'll tick both these boxes, and then it will provide me with a box to respond with my information about infants. So then what I might do is go to the text that I prepared before, and it just allows you to copy and paste that over. Or of course, you can just write it in the text box as you go along. And then because I ticked on older adults, it also brings me up with a box where I can fill in about older adults and move on from there. But because I didn't tick any of the other categories, it doesn't give me the option to respond to those. So then same again, this one about population wellbeing. In this case, I might have something to say about children and young people, and it provides me with the box to do that. Okay, so then moving on, it works through the questions that you've seen in the quick read version. And if you don't have anything that you want to contribute, you can just keep pressing next. Sometimes when it's a yes or no question, you will have to click no in order to be able to move forwards. So if I don't have anything that I want to say about intervening earlier, again, just skip through that question. And pick out the ones that I do want to respond to. So just keep making your way through the survey, responding when you want to. And then this is the last question. About data collection and sharing. So I've got nothing to add there. Finally, you'll get to a page that allows you to review your answers. So you can just scroll down here and make sure that you filled in all the questions that you wanted to and that you're happy with your answers. If not, you can click back and you can go directly back and edit those. See, these are the ones where we didn't have anything to add, so nothing's there. You'll be asked for some feedback on the process itself. And then finally, you'll get through to this page where you're able to submit your responses. So just to say again, as it says here, you won't receive an email confirmation and you won't be contacted individually about your responses. But as soon as you press the submit button, your evidence will be counted and you'll have formed part of the consultation. And as we'll discuss later in the session, we will be keeping an eye on the next steps with this, and seeing how we can take this further, and letting you know what's happened in terms of the development of this plan. Just one more thing to mention briefly is that there's also an easy read version. You can find that, we'll provide the link to that as well. And this just sets out the consultation in a simpler version of English, and you can also respond to this online. So this is something you might have people in your networks who would be happier to respond in this format, so that's also available.